Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Northwell Health to help you sort through what's going on with COVID-19 in our communities and across the region. And of course, as we do every night, we want to hear from you. Call us at the number at the bottom of your screen, 516-393-1800. Well, there is some breathing room now for New Yorkers struggling to pay rent during the pandemic. Today, Governor Cuomo announced no one in the state can be evicted for not paying rent due until mid-August. It's the 20th of August. He says the number one issue people talk to him about is fear about not being able to pay that rent. And this just takes that issue right off the table, at least for now. The governor says the numbers are also coming down dramatically, and we have to stay the course. Statewide, more than 327,000 New Yorkers have now tested positive for COVID-19. That's since the outbreak began. That's just since March, right there. Look at the numbers right there. Suffolk Executive Malone says the positive cases now include results from antibody testing. Now in Long Island, you see the numbers right there. 77,000 more than that have been diagnosed with coronavirus. And COVID-19 related deaths are down, but hundreds of lives still being lost every day. Governor Cuomo says the rising death toll is still painfully high. New York has reached a pretty grim milestone, more than 20,800 deaths. Nassau County Executive Laura Kern says hospitalizations are now down 3 weeks in a row, but the county did see a spike in deaths. Across the island, the coronavirus has claimed more than 3,400 lives. All right, joining us now tonight with our discussion, Dr. Samir Khanijo, a pulmonologist at Northwell Health. Thank you so much for your time and for everything you're doing. You're one of the heroes that we have on the front line, so thank you for everything you're doing on a daily basis. Let me ask you this, as the numbers are going down, are you seeing that in the hospitals? Is that a fair and accurate depiction of what's going on?
That is. You know, we're seeing less patients coming into the hospital with new disease. We're seeing less patients in our ICUs as well, although we still have more than our normal capacity of patients that require intensive care. So although we are on the downswing, it's not by any means over.
So is there a time frame? Are discussions being made as to when things not go back to normal, because there's going to be a new normal no matter what it is, but for like elective surgeries and things where the hospital will start dealing with daily basis business?
There are discussions. I know we're starting to move that way. They're starting to do surgeries that are not purely elective, but things that are important, but were not considered emergent when this pandemic started. So the operating rooms are starting to open slowly, and there are some cases that are starting to be done. So we're starting to get there. We're starting to see more people go back to doing what they did before. One of the things that was nice in the pandemic as this arose was everyone sort of came together. Doctors that were not critical care doctors were doing critical care. Doctors that were surgeons were doing medicine. And so as everyone was chipping in, a lot of these other things were getting pushed to the side, but now people are starting to get back to doing what they were doing normally and what they're trained to do. So I think we're moving in that direction.
Okay, a little bit of good news there. Let's go to some of the calls right now. Norman from Huntington. Norman, you there?
Yes, hi. Hi, Stone. Hi, Doctor. So I'm an essential worker, and I have a health condition called Texas carinatum, if I pronounced that correctly, which is also known as pigeon's chest, as doctors may call it. If I were to contract COVID-19, would this actually worsen my health even more?
So, every case is a little bit unique, and so it's something you'd need to talk to your doctor about. But having any sort of underlying pulmonary disease or thoracic manifestation of your chest cavity may make symptoms of COVID-19 worse, or may make underlying diseases worse. But again, what we're seeing is the majority of people have very mild disease and don't actually end up needing the hospitalization. So the hope is no, but as with any sort of discussion, there's always that caveat that if you start to feel more symptoms, if you start to feel more short of breath, you should actually talk to a provider so someone can see you and take a listen and take a look.
And doctor, speaking of that, I know it's a respiratory virus. Are you seeing people come in who are smokers, typically smokers or vapors?
We've noticed, this disease doesn't predispose for one person type. People that smoke and especially people that vape seem to have a little bit worse disease, but it doesn't discriminate. There are people that have no smoking history that get just as sick as people that have.
Yeah. Okay. How about KYRA from Selden? You there?
Yes. Hi, Stone. Hi, Doctor. How are you today?
Good.
My question is, I'm 6 months pregnant, and I read an article that women who were pregnant were having a lot of second and third trimester miscarriages. I wanted to know if you have heard anything about that. And
Oh, I think we may have lost her there.
We may have lost her, but first, congratulations. What we've seen in the hospital, at least in my side, on our critical care side, on our pulmonary side, is actually most of the women that have been pregnant have done fairly well. Their disease severity hasn't been quite as bad, but obviously we take extra precautions and extra safety. So again, that same idea: if you're having symptoms, go more proactively to your obstetrician. They can be monitoring your oxygen levels a little bit more closely, and there may be a little bit of a quicker trigger to get you in the hospital or get you monitored more closely so that we can watch your oxygen levels. But fortunately, at least in the patients that I've seen, our pregnant patients have all done pretty well.
Okay. How about Rusty from Huntington? Rusty, you there?
Doc, how are you guys?
We're doing great. What's your question tonight?
Quick question about like how much I'm cleaning. I'm cleaning everything from my mailbox, my doorknobs, my steering wheel. If I touch it, I'm cleaning it. I'm wondering if all these cleaners that I'm using are going to end up having a negative effect on me, or like as in, am I taking in too many chemicals, or are they preventing too many good germs?
So I don't think, that's a very interesting question. I don't think the chemicals are preventing good germs. I do think if you're using a lot of cleaners, especially bleach-based products, things that have a lot of odor to them, wearing a mask is not a bad idea. Again, we wear these masks when we go out, and we suggest surgical masks when you're, if you have to go to the store and around. I think cleaning is important, especially if you've been in places or around people where there's concern for viruses. And one of the things I do when I come home every day from work is I clean my car with different disinfecting wipes. And so I do think it's important, especially if there's concern that there's infection. But if you're using them a lot or you're around them a lot in close spaces, then wearing a mask when you clean is a good idea.
Okay. How about Margarita from Levittown? You there?
Hi there. Hi, I'm here. Hi, doctor. I wanted to thank you first off for your service. Thank you so much. I'm a dentist in North Belmore. So as we start to implement our protocol in preparation for reopening to our standard capacity, including having our staff test for the COVID antibodies, what in your opinion is the validity of such a test when we hear people who have had the virus, they can test negative, and those who are asymptomatic can test positive for antibodies?
Right. So, also thank you to you and good luck. I think dental work is one of the unsung heroes as we go into this, because you spend all of your time in people's mouths. The truth is we don't know about the antibody tests yet. If your antibodies are positive, it suggests that you've been exposed to the infection, and that's good. We hope that means you may not be exposed later on or may not be prone to getting an infection later on. If the antibody tests are negative and we know someone had a positive test before, then I don't know. Then maybe we consider that's a possibility for a false negative result and would consider a repeat antibody test. But the truth is all of these tests are new, so we don't yet have enough data to say what their sensitivities and specificities are. And so we're learning. And I think, unfortunately, that's a lot of what we're seeing with COVID-19.
And just to follow up on that, with everything being so new, are we opening up too quickly, or should we be shut down even longer?
I think that's a hard question. As a purely medical person, the reason that these shutdowns were very important is that our hospitals were getting to capacity and overcapacity, and so we were having difficulty with the space to treat people that needed to be treated. As things lighten, and we have, I believe, for the third week in a row, less hospitalizations in New York, at some point we have to get back to real life. And I don't think it's a rush to do it all at once. But at some point we're going to have to get back to a gradual reopening. People have to get back to work. People have to be able to pay rent, and people have to be able to do the things they need. So I think opening up is going to happen, and it needs to happen. Fortunately, I'm not in policy making, and so I can leave that to other people. But I think we do have to find a way to do it safely. And whether that means more testing, whether that means antibody testing, I'm not sure the right answer. But I don't think we can live this way forever.
Okay. We're going to take a real quick break. When we come back, we're going to have much more expert advice on how to keep you and your family safe from the coronavirus. We do want to hear from you, so call us with your questions. The number right there at the bottom of the screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Samir Khanijo, a pulmonologist at Northwell Health. Before the break, we were talking with Margarita. Let me ask you this about treatments. Are you seeing remdesivir being used? I know that's people are touting that as potentially maybe groundbreaking.
We do. You know, we had it as under clinical trial through Gilead up until yesterday. Actually, yesterday evening we got a shipment to North Shore and LIJ, and I think some of the other Northwell hospitals to use remdesivir as needed. The truth is, in my subset of patients that I see in the intensive care unit, most of them don't qualify for remdesivir for either renal function or some other abnormalities. But we are starting to see it be used more and more. You know, I think it gives some hope that we have treatment that, you know, although is not curative, may be able to lessen the viral replication and may be able to lessen the severity of the disease, and maybe over time become something like Tamiflu is for influenza.
Yeah. Okay. Let's go to Mary. Mary, you there?
Yes.
What's your question tonight?
I just want to thank the doctor for his time and his service. My question is, how do we enforce quarantine for people who... What?
Mary.
Oh, okay. How do we enforce quarantine for people who prove who
are positive?
Yes, for the virus. If they prove virus, you know.
Okay, doctor. I know it's more of a policy question, but.
Yeah, you know, that's a very difficult question. I think on a human level, we have to hope as New Yorkers, as Americans, we take the health of our neighbors into account, and that we would do the right thing. I don't know if the right answer is that, you know, people who have the virus and go out, you know, should be put in jail or fined. But I really think the importance of education, and as people get sick, I think they're going to understand how severe this disease can be. And if you look on the news, I mean, there's over 70,000 people in our country that have passed away from this. And really, I think we have to lean on ourselves and our colleagues, our neighbors, our friends, as Americans and New Yorkers, that we do the right thing.
Yeah, that's it's tough. It really is what I do affects you, and what you do,
right?
Yeah, affects me. So that's really where we're at right now. Let's go to Port Washington. Is this Stefan?
It is.
Yeah. What's your question tonight?
Hello, Stone. Hello, Doctor. Thank you for taking my question. So we recently had a family member pass away, and she had COVID, and she was in her apartment while she had it. She has passed, and we are wondering how long will it take for the apartment and the surfaces and the fabrics not to have any virus on it?
You know, first, my condolences. I'm so sorry for your loss. The truth is, we think that these viral particles can live on hard surfaces for about 1 to 2 weeks. If your question is geared in the sense that you have to go in and clean, I think cleaning can be done safely with the appropriate protective equipment, so gloves, masks, and disinfecting wipes. But you know, probably at about the 2-week mark is when the viral shedding on most of the surfaces is probably not there to an infected point.
Yeah, take care, Stefan. That's terrible news. Adriana, are you there?
Yes.
What's your question tonight?
Okay, my question is, now that the summer is coming, is this safer to run the AC and, yes? Okay, my question is, now that the summer is coming, I want to know if it is safer to run the AC, and what's the guideline we should follow.
The air conditioner? Okay, doctor?
The air conditioner should be safe to run from a coronavirus standpoint. You know, obviously you should have yearly or routine maintenance on the air conditioners to make sure there's no mold, no accumulation of excess water or things like that. But from a coronavirus standpoint, the air conditioner shouldn't make much of a difference.
Okay, let's try to squeeze. Chris, are you there?
Hey, how you doing?
I'm doing great. What's your question tonight?
I had the flu shot earlier last year in October. I'm hoping that it prevented from me getting the virus. I'm in very well, feeling good. Is it possible that the virus is being protected by me getting the flu shot?
Although I'm happy that you've been healthy, the truth is that the flu shot probably is not having any effect on you not getting the coronavirus.
Okay, and doctor, I think viewers might be interested. How do you keep yourself safe on a daily basis?
A lot of personal protective equipment. I mean, when I'm in the hospital, I wear an N95 mask basically the entire day. You probably can't see it, but I'm starting to get little marks on my nose. I change my clothes when I get to work. I change my clothes. I come shower when I get home. Lots of Purell, lots of washing my hands with soap, and being as cautious as I can be. You know, to this point, it seems that what I've done has worked. You know, I actually was antibody tested a few days ago, and my antibodies were negative, which suggests that I haven't been or haven't contracted the disease. And so that's the way we go. I mean, I do the best I can with personal protective equipment and being as cautious as possible while still fulfilling my job and my duties, which is to take care of the patients that come and need our help.
All right. Well, I appreciate everything you're doing from me personally and from News 12 and from all of Long Island. We do appreciate that. Unfortunately, that's all the time we have, so thank you so much for everything you do every day, Doctor. And thank you to the viewers for watching tonight and for your calls, and we'll see you tomorrow night right at 7.